the Director of Veterinary Nursing here at the Royal College of Veterinary Surgeons. Here at the RCVS, we set, uphold and advance veterinary standards in the interest of animal health and welfare. We safeguard the interests of the public and animals by ensuring only those vets and veterinary nurses registered with us can carry out acts of veterinary surgery. Wendy.
Hi, I am Wendy Nevins. Thank you very much for the introduction, Anthony. I am the Junior Vice President of the British Veterinary Nursing Association. The BVNA is the representative body for all veterinary nurses. The aim of the British Veterinary Nursing Association is to promote animal health and welfare through the ongoing development of professional excellence in veterinary nursing. Over to you, Julie.
So the aim of today's webinar is to raise awareness of the veterinary nurse, the training and specialisms that they undertake, and to provide advice on how you can make the most of the veterinary nurse within your practice. Over to you, Wendy.
Thank you. So what are veterinary nurses? Veterinary nurses, we work closely with veterinary surgeons and the whole of the team to ensure really holistic care, so complete care of the animals, of your pets. Veterinary surgeons can delegate certain duties to us, and I feel, and I'm sure Julie does, that veterinary nursing is a profession that we are very proud to be part of. We can do so many different things within practice and within animal welfare, and we strongly feel that this should be celebrated, which is partly what Vet Nurse Awareness Month is also all about. It's really about telling the whole world about our job and why we love it so much. We do this job because we have a passion for animals. We want to improve animal welfare, and we want to give comfort to sick and injured animals. And also, very importantly, we want to provide you, our clients, with the knowledge that we know that the patients in our care, your pets, are having the happiest and healthiest life that they possibly can. So, next slide, please. Identifying veterinary nurses. Now, this can be difficult at times because we do often wear very different uniforms. Some nurses wear scrub tops and trousers of different colours. Some have cartoon characters on, but often the standard is the dark green uniform worn by qualified nurses, and student nurses will often wear white with green stripes. But really, regardless of the colour of the uniform, it's our RVN badge, which you can see on the screen in front of you, that signifies that we are both qualified and registered veterinary nurse. The RVN badge is really the centrepiece of recognition of veterinary nurses, and this is what you should be looking at to know how to distinguish within the practice team who you're talking to and who is looking after your pet. Next slide, please.
So all training is conducted through colleges and universities that offer RCVS accredited qualification. There are two routes of training available for student veterinary nurses. The vocational or further education qualifications can be either full-time with a clinical placement or part-time apprenticeship style alongside employment in a veterinary practice. This route generally takes 2.5 to 3 years to complete. You can also do either a foundation or a bachelor degree, which takes 3 and 4 years respectively, and that includes a significant proportion of clinical training within a veterinary practice alongside the academic programme. Whichever route the nurse takes to train as a veterinary nurse, the training is rigorous and includes both written and practical exams along with assessment of clinical skills within the practice setting. Once qualified, there are many career opportunities that veterinary nurses can go into, such as clinical practice, referrals, hospitals, working in some of the universities. They can work in industry such as pharmaceutical companies, insurance companies. They can go into education and begin teaching, and they can also do research. The veterinary nursing profession has many unique qualities. It's a profession in its own right. We have a code of conduct which sets out the minimum standards that we should be working to, and we are accountable for our actions. Whilst we can, under the direction of veterinary surgeons, undertake medical treatment and minor surgery, we're not, and nor do we want to be, mini veterinary surgeons. Unlike veterinary students, we are not able to carry out any operations that involve entering into a body cavity, such as neutering a female cat or dog. Once enrolled with the Royal College of Veterinary Surgeons, student veterinary nurses can, for the purpose of undergoing their training, carry out medical treatment or minor surgery, not entering a body cavity, under supervision. This means that the delegating veterinary surgeon must be present on the premises and able to assist if required. For minor surgery, the supervision must be direct and continuous, meaning that the veterinary surgeon is present and giving the student his or her undivided personal attention. Once registered, veterinary nurses are able to carry out delegated tasks under direction, meaning that the veterinary surgeon doesn't necessarily need to be present or on the premises. Whilst veterinary nurses are an integral part of the veterinary team responsible for the holistic care of their patients, there are many other important roles within clinical practice, such as animal care assistants, lay staff, receptionists, practice managers. And the difference between these roles and the veterinary nurse is that only a student veterinary nurse or a registered veterinary nurse can be directed to carry out medical treatments, such as giving medication, providing fluid therapy, and taking blood samples, or undertake minor surgery. In early 2015, with the granting of the Royal College of Veterinary Surgeons' new Royal Charter, veterinary nurses became recognised as true professionals in their own right. This means that we have to adhere to the RCVS Code of Professional Conduct for veterinary nurses and are subject to disciplinary procedures. With the Code of Conduct comes a declaration that all veterinary nurses are required to make on professional registration in exchange for the right to practice veterinary nursing in the UK. We also have a requirement to maintain and continue to develop our professional knowledge and skills, the continued professional development, or CPD as it's known. This ensures the public that all practicing veterinary nurses are competent and working to a known standard. The required minimum is currently 45 hours over 3 years and takes many forms, such as webinars like this one, in-house training, attending courses, completing further qualifications, and reading. Not only does CPD ensure the best possible patient care, it also facilitates career progression. There are many post-registration qualifications available, including the RCVS Advanced Diploma in Veterinary Nursing, specialist certificates in anaesthesia and exotic species nursing. There's graduate diplomas and masters in veterinary nursing. Vocationally qualified nurses can also top up their qualification to degree level. The qualifications, they vary in length and level, but they do allow nurses to progress their career and to specialise within a certain field. For example, they may go into surgical nursing or medical nursing. They may concentrate more on anaesthesia.
So what can nurses advise you on? As Julie was saying, some nurses specialise in surgery and other areas, and there's also a wealth of nurse clinics, but most veterinary practices now run on a regular basis. So these cover various topics, very much like if you think of your nurse at your GPs and the nurse appointments you can have there. Most veterinary clinics also offer similar veterinary nurse clinics. So we've got weight management. Now this, with weight management, it doesn't necessarily mean that your pet may need to lose weight, but it's also as a preventative measure post-neutering to maintain weight. Wound management is a really interesting topic for a lot of nurses, if that's their area of interest, to deal with, from post-surgery right through to healing. There's the post-op checks, the puppy checks, and then there's also the specialist health clinics, for instance, if your pet has any dental issues or is suffering any problems, i.e. diabetes. And also something that's really important for vet nurses is, I feel, to be involved in preventative healthcare, because most of us would actually much rather prevent your pet becoming ill than having to deal with poorly pets. So that's something that is very important as well, preventative healthcare, and most veterinary practices have clinics and are able to do that for you. Next slide, please. So learning about your veterinary nurse. So as you can see on this slide, on the RCVS register, there is a screenshot, and you've got Julie's details and my details. There's some red areas highlighted. So both Julie and I are RVNs, registered veterinary nurses, and it also there shows our field of work. So mine is industry and commerce, as I am not full-time clinical anymore, and Julie is marked as other. I'm not sure exactly. I think other speaks for itself, being on the RCVS. So that's how you can see and check on the RCVS website, rcvs.org.uk, is to see if the nurse that is looking after your pet is actually registered or not. So next slide, please.
So you can also see on the website whether any of the nurses have undertaken further qualifications that have been accredited by the Royal College of Veterinary Surgeons. So on the screen in front of you, you can see some details for 3 nurses, one of which who has the advanced diploma in veterinary nursing following the surgical route, and one which has advanced diploma in veterinary nursing for a small animal route. And we can also see on the right-hand side a veterinary nurse who is actually a registered equine veterinary nurse. Wendy.
Thank you. So advice. Veterinary nurses in most practices, I know I was when I was in practice, are more than happy to help and advise all pet owners. So the best thing to do is really to, contact for surgery. As I said, veterinary nurses, we have a passion for what we do. We want to help and advise, and we'd much rather prevent a problem than have to treat it. So if you need any advice, very similar to the human nurses, then if you need advice, phone your surgery. Most nurses will be able to advise over the telephone if appropriate, but if not, they can advise you pop down to the surgery. And as we said before, most practices do actually run nurse-led clinics. You may need to make an appointment in advance for this. And also some clinics, the fee structure for nurse appointments will vary from practice to practice, but it's worth just asking that when you're advised to make an appointment with the nurse, just to check that so you're informed before you come down to the surgery. And there will be nurses, as Julie said, that have different interests. One of my favourite clinics when I was in practice was the weight clinics and the older pet care clinics. So it's often good because you'll see the same nurse every time if you have a few appointments. So the nurse and your pet can really bond together and build a relationship that's hopefully going to last throughout the lifetime of your pet and your pet's journey with that practice. Next slide, please. So, do you want to be a veterinary nurse? I think it's a great profession. I've been in the profession a few years now, as has Julie, I believe, and I couldn't envisage myself being anything else. But if it's something that you feel that you want to look into and you want to become a veterinary nurse, there's some websites on the screen in front of you. There's the rcvs.org.uk, and there's also the BVNA, which is the British Veterinary Nursing Association, .org.uk. Both of those websites have got loads of information on how to become a veterinary nurse, the different training routes to becoming a qualified veterinary nurse, and advice on taking the first few steps. I would always advise, and Julie may jump in and correct me if she feels I'm wrong, but if you've never been in a practice before and you feel you want to be a veterinary nurse, I think sometimes work experience is a great way to actually experience the daily life of practice, to know exactly and be sure if it's a career that you want to commit to. Would you agree with that, Julie?
I would absolutely agree with that. Yes, it is quite different sometimes to what people imagine. And I think that actually getting that hands-on experience and being in the thrust of it, then that will give you a very good idea of what a day in the life of a veterinary nurse would entail.
And I think also, if you're trying to get work experience in a vet, if you go to the rcvs.org.uk, you can see and search practices within your area that you would be able to commute to. And I think you do need to be quite persistent, because there are a lot of young adults wanting to join the veterinary profession. So you do have quite a bit of competition. But I think persistence is key to getting your foot through the door. I think I've finished all my slides now, Julie, unless you have anything else to add to anything I've said.
No, I don't think so. I think that's probably concluded the presentation.
Excellent. Do we have many questions, Anthony, at all?
Well, let's just see if anybody wants to ask any questions, if anybody's thought of anything that they just want to cover. So just give a few seconds there. So is it possible that you would have people that were just VNs and not RVNs?
Sorry, say that again.
Is it possible that you could have somebody who was a VN but not an RVN?
At the moment, no. The post-nominals are registered veterinary nurse, and in order to be a registered veterinary nurse, you must be on the register. We do have a clause in our code of conduct that says we mustn't refer to people as a veterinary nurse if they are not on the register. So at the moment, there is no such thing as just a veterinary nurse. We are an RVN.
And also, there are various ways that you can become an RVN as well, isn't there? You can go to university, but you can also do it in a sort of day release type situation as well.
You can. I did explain that a little bit earlier on with the two routes. There is the further education, which involves going to college, generally 1 or 2 days a week, and being either employed or on an apprenticeship style sort of contract with a veterinary practice, or you can do the degree route at either foundation or honours degree level.
No, that's great. Thanks for that, Julie. If anybody has any questions, please put them in. Otherwise, we'll probably call this to a halt. Just before we do that, though, Wendy, obviously from the BVNA perspective, lots of interest in the Veterinary Nurse Awareness Month. Has that been popular?
Yeah, it's been absolutely fantastic this year. We've had the highest number of applications from practices for our Vet Nurse Awareness Month display competition. So that's been phenomenal this year. And we've also been doing a lot more on social media this year on the Vet Nurse Awareness Month page. So it has been really successful. And we also had a stand at the National Pet Show in Excel earlier in the month. So that was a really great opportunity to meet up with loads of pet owners, but also prospective veterinary nurses to try and get the message across about our varied role. And I think one of the things that struck me when I was talking to sort of quite a few pet owners, that a lot of them weren't aware that the RVNs actually monitor anaesthetics. They assumed that the vet did the anaesthetic and the surgery. So I think it was really good to get across that RVNs are actually in theatre monitoring the anaesthetics of the pets as well.
Yeah, and I think that obviously, if anything, just adds to people's trust in what's going on. There's a couple of people being involved in the operations as well, doesn't it?
Yeah.
Now we've just had a question come through. So how many RVNs are registered in the UK?
So we currently have just over 15,000 registered veterinary nurses. Obviously not all of those are in clinical practice. myself and Wendy, obviously,
Yeah.
don't work in clinical practice, and we don't distinguish between those that work in clinical practice and those that don't. We just have the list of who is actually on the register.
Brilliant. If there are no more questions, I think we'll call this to a halt. But thank you once again. I think vet nurses do such a fantastic job. It's great to see that the profession is sort of growing in importance as we recognise, what a very important job you do. There is a quick other question just popped in. Is there an age limit, upper and lower, for training?
There isn't, no. Not at all. There is a minimum entry requirement, which is set by either the university or the awarding body that we accredit. The minimum is currently 5 GCSEs, which need to include maths, science and English. But there's no age limit, no.
Brilliant. Okay. Thank you so much. Thank you, Julie. Thank you, Wendy. And hope everybody's enjoyed that, and looking forward to seeing you on another webinar very soon. Thanks, everyone. Bye-bye.